Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. This video is on the Delay MS study, hot off the press, published online today, March 10, 2025. The study question was, does high-dose vitamin D monotherapy reduce disease activity in patients with clinically isolated syndrome typical for multiple sclerosis? The study population comprised of 211 women, 92 men, untreated patients with clinically isolated multiple sclerosis, aged 18 to 55 years, with a duration less than 90 days. The median age of the cohort was 34 years. It was a double-blind randomized study conducted in 36 multiple sclerosis centers in France. Intervention: 316 participants were randomized, 303 participants were analyzed, 157 received high-dose vitamin D oral calciferol 100,000 international units every 2 weeks for 24 months, and 146 received placebo every 2 weeks for 24 months. The primary outcome was disease activity defined as occurrence of relapse and/or MRI imaging activity, new or contrast-enhancing lesions over 24 months. What were the findings? Vitamin D reduced disease activity significantly compared to placebo. Hazard ratio 0.66, p-value 0.004. MRI activity was reduced in the vitamin D group, 57.1% versus 65.3% in the placebo group. There were fewer new lesions in the vitamin D group, 46.2% versus 59.2% in the placebo group. There was no significant impact on disability, fatigue, or anxiety. Safety: no major adverse events. Only 2 individuals had mild hypercalcemia. Future directions: high-dose vitamin D may delay multiple sclerosis progression. It could be a cost-effective alternative with low risk. More research is needed on combination therapy. These findings suggest vitamin D is an immune modulator. Another study showed that vitamin D insufficiency altered fatty acid and lipid metabolism, and supplementation lowered acylcarnitines, suggesting it affects the myelin sheath.